we're moving away from pregnancy is endometriosis. Okay, I thought PCOS was a very common diagnosis, but after talking to many OBGYN, I'm realizing that endometriosis is also getting there equally. Can you tell us if a woman has irregular bleeding, either excessive bleeding or decreased bleeding, is that what endometriosis is?
So endometriosis is it's like, you can have cancer, but you should not have endometriosis because cancer is curable, but endometriosis is not curable. Okay, it's a very unfortunate to see young girls who get endometriosis. So endometriosis can come to anybody. The symptoms can vary, like how you told, they'll have excess bleeding or they may have severe pain. So what happens, why endometriosis? Why me, doctor? They come, why me? Young girls we see at 18 years, 20 years. Some people get endometriosis after 40, but some people, they get at 20 years, 22 years. So it is a chromosomal problem. It is not because you have had abnormal diet or you don't have a proper lifestyle, you have not slept properly, you have not ate properly. It's not. It's not in your control. It is destiny that you are supposed to get endometriosis. So what are the symptoms they can have is in a younger age, they'll have the severe pain, the dysmenorrhea, what we say, they'll have severe pain which can, 2-3 days prior to their periods and then during the period, and it can last for 4 to 5 days after their periods is over also.
Oh my God.
So that is a pain what they'll have. And it's excruciating pain. Because of pain, they cannot go to their school, college. They'll have nausea, vomiting, all the symptoms.
But there'll be these symptoms may be normal as well around
Yeah.
the perimenstrual period.
Yeah, it can be normal, but the intensity of the pain, if the intensity of the pain is very severe, then we have to keep it in our mind that endometriosis could be one of the differential diagnoses. And then these people who are having excess bleeding. So what happens in endometriosis is, so there is a uterus from where the blood will come through the vagina. So here the blood will go in the retrograde direction. So the blood will flow. The 50% of the blood is coming through the vagina. It is coming out. Another 50% will go in the retrograde through the fallopian tube, and through there it will come and enter into the
Ovaries.
pelvis. Yeah, pelvis
Oh,
and
it's a
ovaries. Yes. So the ovaries are there right there. So it will fall on the ovaries. So it cause ovarian endometriosis. Okay, that is called
It
as
can spread.
endometrioma. And then these blood tissues can fall on pelvis anywhere. So then we call it as pelvic endometriosis. It can also fall on the intestine, which is all nearby. So then it becomes a problem. What happens is, so blood is getting collected every month. So it's a small cyst. Then next month it will come, it will increase. So when it becomes grade, it starts with grade 1, 2, 3, 4. So grade 4 is when the whole of the ovary is enlarged and it is kissing each other. It's called as kissing ovaries. Okay, the two ovaries are fixed. The uterus is fixed here, and all the intestine surrounding were all become fixed. So it becomes a frozen pelvis. Wow. This is endometriosis, which is very difficult. If it is identified early, there are luckily we have a lot of medicines and options available now, which if identified early, we can at least prevent them to going to this grade 3, grade 4.
So let's say I'm a 24-year-old woman and I get my cycles like once every 28, 29 days. First month I'm getting around, I'll bleed for like 3-4 days. Now I'm bleeding for 7 days. First month I didn't make a big deal of it. Second month is also 7 days. So when should she come and see you?
So if you see what is normal, when a lady is having anyway periods between 24 to 35 days, it is normal. Okay, and when you're having a bleeding, anyway,
35 days is also normal?
Yes. 35 days is also normal. It's not necessary that you have to get your period every month. It's a myth. There's no need. You can get your period 24 to 35 is a normal cycle. First thing. Second is the bleeding. The bleeding 3 to 5 days is normal. Normally you change around 3 to 4 pads per day. There should not be any clumps, that clots. That should not be there. First day pain is normal. Anything out of this box. So you're getting a period pain for more than 4-5 days after your menses is over, or your pain is coming prior to your period's onset. You're changing more than 6 to 7 pads per day. The pad is fully getting soaked. You're having clots, clumps. And then you are having a bleeding for more than 6 days, 7 days. Then it is a time that you have to go and see your doctor. Even if it is the first time, at whatever age, please go and consult a gynec, because it can be a precursor for endometriosis also.
Okay, okay, okay.
So this is the time you have to go and see your doctor.
Okay.
Then what we basically do, first thing what we do is we do an ultrasound. So in a younger girls, we only do a transabdominal. But if you're married, then ideally we prefer a transvaginal scan because that is the best. So then you do a scan, we find out what is it. If it is not endometriosis, very good. Then we just give you symptomatic medicine to reduce your bleeding, to reduce your pain. But by chance, if we identify that it is endometriosis, we can treat it then and there. And then, you can prevent it from growing it to grade 2, 3, 4 like that.
nice.
That is a best time to identify and treat it.
I'll tell you a scenario. Patient I saw. This patient has left-sided abdominal pain
Okay.
each and every time during her menstrual period. Okay, 5 days, and then after the period is gone, she completely normal.
Yes.
She came to me. Multiple testing done, CT, abdomen, everything is negative. I do a colonoscopy. I see these endometrial spots in the sigmoid colon.
Correct.
Then we track back, and then they say that I've been bleeding for like 7 days. That's been my norm in the last like 8. I thought it was thyroid. Thyroid can cause prolonged bleeding, but only when it is high, correct?
Yes.
When it is low, it should
It will cause hypo.
decrease.
Yes, it will decrease the bleeding. And again, thyroid, when it is too high only, if the TSH is say 10 and above, that is the time when it will interfere with your menstrual cycle. It's not like, your thyroid is 5 and because of that thyroid, my bleeding problem. No, it's not like that. It's only like, and this.
Significant.
Yes, it's not, it's significant only when it goes more than 10.
10.
Yes.